help us out. What's going on with healthcare? So, the first attempt bombs, and then the president looked like at one time wanted to walk away from it, and then the White House says, "No, we really want to get something passed before the 100 days, so we can say we've repealed Obamacare." And yesterday, the Tea Party, otherwise known as the Freedom Caucus, they come out and say, "Okay, we finally got a bill that we'll support, and we give it our full support." What does it do, and what are the chances that they're actually going to get this done? They're going to vote on it tomorrow?
Well, that's not clear. But you're right. The Freedom Caucus worked actively to take a bill that they didn't have enough votes to bring to the floor a couple weeks ago, and they've actively made it worse. They have taken provisions that that protect pre-existing conditions, that are there to make sure that the insurance people get is actually insurance. And
so all the good parts of Obamacare.
The things that actually make it so worthwhile, and they're undercutting it. And, of course, they include in this the provision to unwind Medicaid, which is the largest health care program in the country, which they would destabilize, that they would make a one-way trip to restrict coverage in the future. I think it's a stretch. I mean, I had conversations this morning with a couple of people we call in the governing wing of the Republican Party.
Tuesday group, so-called.
Well, there are people there who are grown-ups who are deeply concerned about the implications. And not all the Freedom Caucus has signed on. Maybe it's not bad enough for them. And the fact is that all the preliminary indications are, as the facts come out about what they're talking about, the public is less enthusiastic about it than they were before. So I think it's doubtful that it'll be voted on Friday. Not impossible, but having made a bad bill worse, I don't know is the formula for success.
They by drawing up a bill that would appeal to the more radical members of the caucus, the Freedom Caucus, and the Freedom Caucus members themselves, they must lose some people in the middle, right?
Well, it doesn't shore up that support.
Yeah.
And ironically, what is happening now, it's slowly sinking in that the primary beneficiaries of the Affordable Care Act were people in red states that had less insurance, less access to health care, and greater needs. And these stories are coming out with people, it could affect our coverage. And what's happening in rural and small-town America, because the Affordable Care Act has been a lifeline to those troubled hospitals, if they lose that coverage, it's deeply troubling. And my colleague, Greg Walden, who's chair of the Commerce Committee and had a hand in writing this, got an earful when he returned to his district because it's very unsettling. His district is more dependent than any in the state of Oregon, one of the most dependent in the entire country, and it would be devastating to his people. People are noticing.
Yeah. That happens. He's the congressman in Bend and Hood River. And our son Mark went to the town hall in Bend, where, you're right, Greg Walden really did get an earful from the people there. And, Bend's not a big liberal stronghold. It's good.
Right.
It's getting bluer.
Getting bluer, yes. But
you've done this long enough to know that the one thing you can't do as a politician is promise your constituents something and give your constituents something and then take it away from them. And that's sort of the only option that Republicans have here when they talk about repealing and replacing. Like, they're going to have to face those constituents at some point, which is a loser. It's going to lose.
Well, but we've commented here on previous visits that there is a bait and switch tactic that many of our Republican colleagues have done in the past. I mean, they talk about things that they're going to do, but they end up actually penalizing many of those constituents, people in terms of food stamp, SNAP benefits. Well, the heaviest recipients are in some of the poorest, reddest districts. This what's wrong with Kansas dynamic. But throughout Appalachia, in Kentucky, the reliance on the Affordable Care Act. And this is something that this cognitive dissidence has not met with full recognition. But I think it's starting to occur. When we look at what's happening in Kansas with there being sort of the test case for Republican slashing taxes and budgets, it's changing politics in Kansas these days.